This lecture will review parenteral medications, and this part 1 will review important application principles of ophthalmic, otic, inhalation, and topical and transdermal medications. All medications that are not ingested or introduced into the GI system are considered parenteral. These are topical, ophthalmic, otic, vaginal, nasal, inhaled, and injectable. Just to let you know, some references consider only injections as parenteral medications and classify the rest of medications that we just reviewed here as percutaneous, which means affected through the skin. Topical medications are applied to the skin. Examples are ointments, creams, powders, lotions, gels, liniments, and transdermal patches. The absorption of topical medications can be influenced, though, by drug concentration, how long the medication is in contact with the skin, the size of the affected area, and hydration of the tissue. The action of these drugs in general is localized to the site of application, which reduces the incidence of systemic side effects. However, topical medications can also achieve a systemic effect by maintaining continuous release of therapeutic doses of a drug. Ointments are petroleum-based and they work to keep the medication in contact with the skin. Bactroban is an example, and that's an antibiotic ointment. Creams are water-based and are absorbed into the skin. Oxy-10 for blemishes is an example of that. Lotions are half water and half oil, such as calamine lotion. When you apply these topical medications, make sure the skin is intact, clean, and dry to enhance absorption, and always wear gloves. Transdermal patches are easy to apply and they provide a controlled release of medication through a semi-permeable membrane for several hours to 3 weeks. Disadvantage of patches is that they may fall off. In the home setting, it's important that family members aren't exposed to medications, so we need to teach our families to wear gloves when they're handling these medications. Also, pets and children can get into the trash, so we need to teach them proper disposal of these patches. Some examples of patches are nicotine patches for smoking cessation and pain patches. Make sure that you wear gloves when applying these patches so that none of that medication you are working with is transferred to you. Make sure that you cleanse the area where the patch is removed. If not, medication will remain on the skin and the patient will have a higher dose of medication than they should. Lastly, always alternate application sites to decrease incidence of local skin irritation. When we give otic medications, we use the pinna to straighten the ear canal. The pinna is the visible part of the ear. With children, we pull the pinna down and back, and with children over 3 and adults, we pull the pinna up and back to straighten the ear canal. Drops should be given at room temperature to avoid discomfort. Above you see the medical abbreviations for the ear, and AU is both ears, AD is right ear, and AS is left ear. For ophthalmic medications, we have the patient look up and we instill the drops into the conjunctival sac, not directly on the eyeball. The conjunctival sac is the space between the eyeball and the eyelid. Take care when handling ophthalmic medications. Don't touch the tip of the bottle with your hands or to the eye. We want to keep it sterile to avoid infection. This is why we wear gloves when we apply eye drops. When you're finished applying the drops, you always want to put light pressure with a finger on the inner part of the closed eye. That's the lacrimal duct. This keeps the medication from entering the canal where it will produce systemic effects. The letter O is used in abbreviations for ophthalmic medications. When applying eye ointment, you want to make sure first that the eye is dry and clean. If there's any drainage, you want to gently just clean that from the inner part of the eye out. Again, don't touch the tip of the medication applicator to the patient's eye or your fingers. Now have the patient look up and you want to apply a thin ribbon to that conjunctival sac. Nasal medications are used for seasonal allergies and asthma. When using a nasal spray, the patient will inhale while squeezing the bottle and closing one nostril. Inhalers give quick and effective access of the medication to the blood vessels of the lungs. To use an inhaler, want to shake the inhaler several times. Instruct the patient to take a deep breath and exhale completely. Then inhale slowly and deeply through the mouth and depress the medication canister and breathing in for 2 to 3 seconds. Then the patient should hold their breath for 10 seconds. Many patients don't get the maximum benefit from their inhalers because they don't use them correctly. Aero chambers help with this, and they fit on an inhaler. How they work is they trap the medication in a chamber, which the patient then inhales within a few seconds. This improves the patient's ability to deliver a proper dose. In this picture, you see an inhaler with an aero chamber and a pediatric mask. Sometimes powders or drugs in solutions are added to equipment called a nebulizer that introduces medications by using compressed air. It turns the medication into a fine aerosol that can be inhaled into the lungs. Oxygen is considered a medication and requires a doctor's order. It can be given through a mask or nasal cannula. A CPAP, or continuous positive airway pressure machine, forces air or oxygen into the lungs. It's used many times for individuals with sleep apnea. CPAPs require air to be moisturized to avoid drying out the skin and the mucous membranes. Well, that concludes part 1 of parenteral medications. If you have any questions, let me know. Bring them to class or to the Farm Cafe.